time. I'm going to discuss with you today health literacy and its effect on our patients' outcome. Health literacy is a term that's being thrown around a lot lately, especially with the passing of the Affordable Care Act. Basically, all health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and the services they need to appropriate health decisions. With reimbursement being closely tied to patient satisfaction, the burden of patients experiencing a positive outcome is weighing more on the providers, and as nurses, we provide them care. So a patient with a limited understanding of his or her diagnosis or medications will not be able to effectively manage their own care. For example, a patient that is a diabetic and they don't know that they're not supposed to be eating potatoes, and they keep coming in, I don't know why my blood sugar's up, I don't eat any candy. Well, you got to explain to them also that carbohydrates turn into sugars, and that's why their blood sugar is 500 today. Healthy People 2000 is a program of nationwide promotion of and disease prevention goals set by the U.S. Department of Health and Services. Healthy People 2020 provides science-based data every 10 years for improving the health of all Americans. Information provided by JACO is often used to determine their goals. So if we follow Healthy People 2020, we can also feel assured that we will do well when JACO comes back. Healthy People 2020, their vision is a society in which all people live long, healthy lives. One of the goals for this decade is to increase health communication and health information technology. A lot of things that they're pointing to these days is they want the doctors to push printed information. They want them to push information on the computers. They want patients to be able to say, yes, my doctor did lead me to the right website. Yes, my doctor did spend time with me. Yes, my nurse did explain things to me. All that goes into the patient satisfaction, and that affects the reimbursement the hospitals get back from the government insurance companies such as Medicare and Medicaid. Let's see here. Levels of health literacy. There's 4 different levels. Nearly 36% of all Americans, that's more than 87 million, are considered functionally illiterate, meaning they go through life every day, but they actually can't read, or they can't fill out an application, or they can't read a prescription bottle. Only 12% of the adults have proficient health literacy, meaning you could say, here's your health instructions, your discharge instructions, have a nice day. Basically, in order to fall in the below basic health literacy, most of these people have an education to where they might have completed high school, but mostly did not. About 15% of the people who did complete high school actually are below the basic level. Language is another category that fits into below basics. Anyone who spoke a language other than English prior to going to school, they're not going to have a very high health literacy. Self-reported health, the patients that tell you that they're fair to poor health already, they automatically go in that category. Hispanic adults have a lower average health literacy score than adults of any other racial group. Adults living in poverty level, they have a lower health literacy score. Adults over 65 also fall in that group. 53% of adults without any medical insurance and 32% of adults who have some sort of medical insurance still fall into that low group. Anyone with a disability, one or more disabilities, such as a hearing impaired or vision impaired or a learning disability, will fall in that group. And your prison status, either currently or previous incarceration in the prison, your status, you also fall in the low. A basic health literacy is someone who's able to read just short, simple sentences, who can read at least a 6th grade level. They're most likely they're going to struggle trying to understand why they can't drink orange juice every day if they're a diabetic, because oranges are supposed to be good for you. If you're intermediate, you can take that prescription, you can look at a graph, or you can look at a box of cereal and say, no, I can't have this. And if you're proficient, you can just open up a literature book, skim through it, and say, okay, I know what I need to do for my health. Barriers, the single biggest problem in communication is the illusion that you think communication has actually occurred. It could be you're sitting there listening to your instructions and they're shaking their head. Well, in the Hispanic community, that is just a sign of, yes, I'm hearing you. In the Asian community, that's just a sign of, yes, I'm listening to you. So don't automatically assume because someone's shaking their head, they're understanding what's going on. Culture, we all bring our little bits of culture in, and our different languages in. What someone calls one thing, someone else calls something else. I remember when a man first asked me for a duck, I had no idea what he was talking about, and I stood there for a couple minutes like, what? And of course he wanted a urinal, but I had no idea what he was asking for. Patient motivation, it doesn't matter how hard you try, it doesn't matter how great of an educator you think you are. If the patient doesn't want to learn, if the patient wants to go out and have that cocktail with the girls every night, or he wants to have that pizza and nachos with the boys watching football, there's nothing you're going to be able to do to change that. Also, once again, one of the same issues that can place a person in lower health literacy category is income. Adults living in the low poverty levels will have a lower health literacy. Simple ways to teach our patients is just to use, of course, simple terms. Don't use jargon. Keep it simple. Use layman terms. And instead of saying urinate, say potty. Instead of saying abdomen, say stomach. Environment, you need to create a good environment that's conducive to learning. Turn the TV off when you go in the room. Politely ask people to hang up the phone so you can talk with them. Shut the doors. This gives people an indication that you have something important you want to discuss with them. And look at them. Look at them face to face. Don't be documenting. Don't be walking around trying to get ready for the next patient. If you look at them, the patient will have an understanding that this is something important that you need to tell them. Always be respectful to the patient. Address them as sir or ma'am unless they give you permission to address them in another way. Try to avoid things like boo and dear. Some people are insulted by that. Open-ended questions. One of the best ways you're going to get information is to use an open-ended question. Don't give them out of just saying yes or no. You'll learn so much by letting the patient just spill their guts to you and accidentally say, well, yeah, I've got some hydrocodone at home. Well, I thought you just told me you didn't have any. Best opportunities to teach is when you're conducting your assessment. If a patient just said, well, I was just diagnosed with high blood pressure, and they just gave me some this little blue pill to put my blood pressure down, well, and they're here for dizziness, you could let them know, well, a lot of blood pressure medications can make you dizzy, can make you sleepy. That might be one of the reasons why you're having this symptom. Administering medications. When you go in and administer your medications, it's another great way to educate your patient. Tell them that the doctor has ordered this medicine for their pain. Side effects could make you sleepy, so I don't want you to get out of bed without calling me because I don't want you to fall and hurt yourself. You're educating them about the medicine you gave them. When you're preparing a patient for a test, if you're starting an IV, use your simple terms, but say, I'm gonna put this little tube in your vein, so when they go to those pictures on your head to find out why you're having headaches, they'll be able to put some dye in there, and they'll be able to see your veins. Hopefully this will help you or help us determine why you're having headaches. And one of the biggest and best times to educate is on discharge. This is when you get to use all that information. Plus they actually have some really good discharge instructions here. They have it broken down in simple terms. They have the diagnosis in simple terms. They've got the medications listing all the side effects, when you should take it. They've got who you should follow up with, your primary care physician, a specialist, and they even put down the address and phone number there, and they even tell you that You don't need to return to the emergency room unless your condition gets worse. Any interaction is a great time for education. When they're walking out the door, say, have a good day. Don't forget to get those prescriptions filled, and don't forget to follow up with your doctor. That's another opportunity. Real quick, some methods for teaching is the teach back technique, which we will probably never have very many opportunities to do here. This is where you show the patient how to do something, and they show you back. Verbal, people with poor reading skills, this is the best technique to use for them. Sit down, discuss the discharge instructions, actually point at this is your diagnosis. Written, it's our discharge instructions. Demonstrate, do one, see one, do one, teach one. That's the best way to do it. Have them redo what you just showed them, if it's showing them how to inject themselves with insulin. And then, of course, repetition. Repeat yourself over and over and over and over again. You need to take this medication twice a day. You need to take this medication twice a day. Don't forget to take your medication twice a day. And last, refer them to websites. There's a real good website called Get Well Network that breaks everything down in basic pictures. It shows them every little basic thing about their anatomy, but in simplistic terms. Caring for patients who continue to behave in harmful ways can be it can be personally frustrating and professionally unsatisfying. It can make us feel powerless, and it can make us lose empathy. But we are nurses, and patient education is the cornerstone of nursing. So we need to continue to educate our patients at every opportunity that presents itself. I thank you very much for your time, ladies and gentlemen.